One of the biggest fears CDL drivers have before a DOT physical is blood pressure. I see it every single week. Drivers walk into the clinic already nervous because they think one elevated number automatically means I'm going to lose my CDL. And that is not true. So let's talk about how DOT blood pressure actually works, because a lot of drivers are getting scared before they even understand the process. First, yes, blood pressure matters during your DOT physical. DOT medical examiners are looking at whether your blood pressure is controlled enough for you to safely operate a commercial motor vehicle. That's the key, safe operation. But what many drivers don't realize is that there are different certification lengths depending on your blood pressure numbers. For example, if your blood pressure is below 140/90, you typically qualify for a 2-year DOT medical card. Now, if it's elevated, that does not automatically mean failure. A lot of drivers are shocked when I tell them that. Depending on the situation, you still may qualify for a 1-year card, a temporary certification, or a shorter monitoring period. That's why it's important not to panic before your appointment. And honestly, some drivers accidentally raise their own pressure right before the exam. I see this all the time. Drivers rush into the clinic stressed out, they're running late, drinking 2 energy drinks, smoking cigarettes in the parking lot, arguing on the phone, not sleeping the night before. Then they just sit down immediately for a blood pressure reading. Your body responds to stress. Nicotine can temporarily raise your blood pressure. Energy drinks definitely can raise your blood pressure, and lack of sleep can also affect your blood pressure. And for some people, anxiety alone can elevate your numbers. That's why preparation matters more than drivers realize. I tell drivers all the time, prepare your body before your DOT physical. Hydrate well the day before. Try to sleep, avoid stimulants right before your appointment, and give yourself time to calm down before walking in. These decisions can make a real difference. But I also want drivers to understand something important. Don't ignore high blood pressure. Outside of your DOT physical, your CDL matters, your career matters, but your long-term health matters too. High blood pressure affects your heart, your brain, your kidneys, your circulation, and your overall performance. Many drivers spend long hours sitting, dealing with stress, poor sleep, inconsistent meals, and dehydration. So this isn't about passing a DOT physical. This is about protecting your future health too. I'm Dr. Pope. I'm a certified medical examiner and occupational health provider in the Atlanta, Georgia area. Follow this channel for DOT physical, education, driver wellness, compliance information, and real-world CDL health advice drivers actually need.